from what your historical account is with the CWC, where it came from, how it evolved, and maybe where we are up to this point in time.
Sure, I can do that. Thank you for having me do this. So CWC was originally brought to life about 10 years ago, and the purpose of it was to provide sort of an urgent or convenient care option to school district employees and their families. Mm-hmm. Alongside of that, it was kind of a all-encompassing, so certainly treating things as they happened and for those urgent needs, but it was also to provide some opportunities for wellness and prevention. So it's kind of a cool model, because we certainly can take care of people in their time of need, but we can also help people to be healthier and to kind of make some of those lifestyle changes and things as they go along to improve their overall health. So that's a little bit about what the clinic does. Sherri,
you mentioned that, this is a bit unique, but how unique is this? Is this the CWC? Is it a model that is used in other districts that you're aware of, or is this something that's pretty much it's got its own space?
This one is pretty unique, and there are certainly some of the other school districts, in the area that have something similar or have access to something similar. Not quite the same as we do, as far as having the wellness and preventative side with the treatment side, as well as a couple of years ago, kind of when COVID hit, we wanted to offer something to those, we weren't seeing as many sick people in the clinic because we weren't sure what was safe and we didn't have a way to test people. And so we wanted to make something available for people that were healthy and well and wanted to become healthier. And so a couple of years ago, we started our medical weight loss management program. And so that's kind of the third leg of what we do at the clinic. But to answer your question, that piece, of course, is very unique. And then just really sort of the mixture of services that we provide is unique, as far as I'm aware, as to what other school districts offer, and that we provide this to employees, spouses, and their children, and make that available to spouses and dependents, even if they're not on the district insurance.
Yeah, absolutely. I think real quick before we get into some sort of the heart of what we wanted to talk about tonight, which was getting to know your numbers and what numbers do we need to know about and specifically. But before we actually go down that path, you play several roles in the existence of the CWC. Can you share a little bit about what you actually do in your position at the CWC, at the Wellness Center?
Sure. So my position is unique in that I am the director of the clinic, and so I oversee and orchestrate the operational side, but I also see patients. I'm a nurse practitioner, so and I see that same group of people, whether it's for illness, prevention, weight loss, any of the above. And so that's pretty much the quick and easy way to explain my role at the clinic.
Absolutely. What got you started in healthcare to begin with?
Oh gosh. So I'd love to say that it was some really cool thing. Like, I always wanted to be a nurse ever since I was a little girl, which is sadly, I'm sorry, that's not true. I actually had my oldest sister thought that was a good career path for me. And so as I was starting to, so as I was wrapping up my senior year of high school, I had a near fatal car accident. And so I was in the hospital this summer between the end of my senior year and the start of college. And, if I didn't know before that, I sure knew after that how important it was to have good people in healthcare. And nobody wants to be in those situations. And so I found out really quickly how important it is to have good people to take care of you.
Okay, let's get into the heart of what we wanted to talk about. Okay, First of all, let's talk about those numbers. And we had a chance to visit a little bit before this call, but I'm very curious and what you feel are those numbers that we really need to know. To what extent do we need to know these numbers? And what can we at the CWC actually provide for? And do some of these numbers go beyond what our capacities are at the CWC? Anything that you can tell us about what is most important in recognizing those biometric numbers?
So that's a good question. So I'm kind of a numbers nerd, and I would, anything and every number I could get my hands on, I like to know that. I think it's really important to remember that every bit of objective information that you have about yourself is just one more piece of information to kind of help with your overall health and wellness. And so certainly there are certainly lots of different tests and numbers and things that we could gather and learn about a person. But some of those basic ones are things that we provide at the clinic, and they're of no charge to the patient. And some of those basic numbers are, we have the ability to do a cholesterol panel. We have the ability to check a person's glucose, their A1C level, all of which are very important for just your basic understanding someone's risk for heart disease, risk for type 2 diabetes. And we offer those to any employee that would like to take advantage of that. Alongside those, that same idea of what numbers are important are somebody's vital signs. So their blood pressure, their pulse, their oxygen level, height, weight, those things are objective information that we can look at and give advice and things of how to improve that, or what that might mean for someone's health. If those numbers are out of whack, what can we do to improve them? So, we offer those as a service to the employees or to our patients, and it's super simple. You call the clinic anytime, make that appointment, come over, and like I said, it's free of charge. So I recommend people get them done at least once a year. If you're making some changes that you're really kind of wanting to monitor your progress, you could even have them done every 6 months if you like. In fact, we've made that part of our weight loss program. We measure those biometrics every 6 months. It's so rewarding. I mean, certainly when the scale moves, but the things that we don't see on the inside that are just as important for indicators as to our health, and that's to those biometric numbers, those cholesterols and A1Cs that we can measure and see the progress that someone's made by making some lifestyle changes.
Sherri, if somebody's not super familiar with the terminology, so what does that represent? What does the A1C? What does the what does it mean with cholesterol? So I guess my question would be, what does this feedback information actually mean to the individual themselves?
Good question. So the A1C is kind of an opportunity to look at what a person's blood sugar has been running retrospectively for the past 3 months. It gives us kind of an idea as to the average. So certainly someone could have, real highs and real lows, but overall and in general, it gives us an idea of what that has been running for the past 3 months. So, and especially this is true. I mean, this is true of type 1 or type 2 diabetes, but very common with type 2 diabetes. If we were to just check your blood sugar on the spot, let's see what it is. It could very well be normal or close to it. But a person could also be running mildly to moderately elevated for days and weeks, and then we would be much more likely to pick that up on an A1C. So it would give us that look, or let us know that something's been going on with this blood sugar, that it's been running higher. And certainly, there are things that we can do, from lifestyle changes to medications, if somebody's A1C is elevated. And what did you ask me about cholesterol too? You asked me what that entailed.
Yeah, maybe expand a little bit on what that profile looks like when you get the report back in regards to cholesterol levels.
Yeah, so again, both tests are just a little tiny finger poke. So it's kind of cool that we're able to get all this information from such a small blood sample. But on the cholesterol panel, we look at a person's total cholesterol, their good cholesterol, their bad cholesterol, and then their triglyceride level. And so just even with those four numbers, we can look at those and look at someone's risk for developing heart disease. And certainly there are other things that go into it and get a better idea. But just with those four numbers, we can already kind of get a sense of things. And by looking at that very quickly, we're able to provide information and education to help somebody improve those numbers.
You know, we can get into this a little bit more in detail as we wrap up, but I'd be curious, what are your general thoughts in regards to, let's say somebody has a modestly elevated cholesterol level, modestly elevated triglyceride level, in regards to like medication versus lifestyle changes?
It really is up to the individual. Certainly there is, hereditary elevated cholesterol, levels, and we can only do so much about our genes. However, from a lifestyle standpoint, we can make big changes to those numbers just simply through activity, through our nutrition, and not smoking, things like that will quickly change those numbers. So yeah.
What would you say that you have seen maybe as tendencies, Sherri, over the last several years, maybe even the last year, in regards to what's crossing your radar with some of the biometrics that you're exploring with individuals that come into the clinic?
So certainly we've seen, and this isn't just true of the clinic. I mean, this is certainly true of our country in general, but the numbers for A1C that's looking for diabetes, and certainly the cholesterol levels over the last years have steadily risen. Just in general, those numbers are on the rise. And I could bore you to death with statistics, but the percentage of healthcare dollars that are spent on diabetes and heart disease, are just astonishing. They are a big contributor to the health of our country. So yeah.
One of the things that the medical industry speaks a lot about, sort of like the 3 stages of diabetes, and you hear about being insulin sensitive, then pre-diabetic, and then of course full-fledged diabetes. Any thoughts on what that scope and scale means?
Honestly, it's one of those things. It's one of those scales that I hate to say it, but I really dislike it, because when you say someone is insulin sensitive or pre-diabetes, it gives sort of an impression that your body's just sort of thinking about having a problem. And truthfully, that term was really used more so to help guide the provider side as to what we're going to do as far as medications and so forth. And so really, if you're already hearing those words, there's already a malfunction. There's already something going on. And so it's not just you should be thinking about that this could be a problem. It's actually already a problem. Mm-hmm. And so it's something that needs to be addressed before the problem gets bigger. So it's just really more the size of the problem, but it is already a problem.
Is there a way to really kind of determine in your mind what the most significant numbers are? What are the most important things to really make judgment upon? Or is it a total combination in an entire package?
I would say it's really a total package. I mean, certainly the A1C that is really more the 3-month average of blood sugar is likely more informative and more helpful than just a spot blood sugar check. From a cholesterol standpoint, again, it's a calculation of those four numbers that really helps us determine heart disease risk. But the interesting thing about that is each of the pieces and parts of the cholesterol can be affected in different ways by doing different lifestyle changes. So, for example, your HDL, your good cholesterol. I mean, I like to think of HDL as sort of the moisturizer, for your blood vessels. We want to keep them soft and squishy and pliable to prevent hardening and plaquing. And so, one of the best ways to keep your HDL up is exercise and not smoking. So, oftentimes I think we've jumped to, it's always about what you eat. And certainly that is a huge contributor, but there are things that you can do that could improve that has nothing to do with the food that you're eating.
We talked a little bit in the office the other day, kind of prepping for our call, and Courtney mentioned a question that I thought was very relevant. She said, whether it's medication or whether it's lifestyle changes, if someone had, let's say, slightly elevated numbers, how long does it take, either with medication or with lifestyle changes, to make some changes in the positive?
I generally say let's check every 6 months, so that you give your body a chance to change and sort of give your body a chance to respond to those changes. And certainly a person could check them more often and might see some change in the numbers sooner, but it's generally advised to wait 6 months to get it rechecked.
What about gender specificity? Is there any major differences in how you view numbers or what you're looking for, male versus female? What does that look like to you?
So in general, we just use a standard normal range, essentially. Certainly some other more specific testing and in specialties like in cardiology and so forth, they use things that may have more of a emphasis on gender, although we don't really do that so much in the clinic.
I guess one of the things you sort of touched on this earlier, but I'd like to go back to say, other maybe things that are not just showing up in numbers, but what are some of the other things that we're seeing health-wise that are of a bit concern, that maybe tendencies we as your time has been there now for several years, and talking with other health professionals, what are some of those concerns right now?
So really, as far as, and I kind of said a little bit about A1C, but also from a cholesterol standpoint in general, it's actually become far more common for someone to have, an out of range cholesterol level as used to be. The common thing was people's cholesterol was normal. Now it's almost uncommon when I see someone that has normal cholesterol. So certainly some kind of out of range number is pretty common. I would also say that I just lost my train of thought. Gosh, that's what happens when you work all day. Goodness. I forgot what I was going to say. Anyway.
In regards to those specific numbers, what I guess they obviously, I've seen charts, I've seen numbers, that are acceptable in different ranges of age. What are those numbers? What do they sort of look like in general?
Okay, I'm sorry. That's exactly where I was going with that. So certainly a total cholesterol, ideally a person's number would be under 200. Mm-hmm. And then, the HDL is sort of slightly more gender specific than maybe some of the other numbers. women have a harder time raising their HDL. And so, like I mentioned earlier, things like exercise and not smoking will help increase that. Your triglycerides goal is always going to be less than 150. Triglycerides are kind of, I always refer to them as a tattletale. They sort of, when you consume more calories than you need just for your body's normal functioning and normal calorie intake and so forth, the triglycerides will elevate with that. So one of the numbers that can change the most with eating is the triglycerides. And certainly that's true of the LDL too, but things like eating healthy fats will help reduce your cholesterol levels. So to answer your question originally about, over the time and over years, certainly all of those numbers, have they're not as good as they used to be. And I think, I think this is just my personal opinion, but I think that's very commonly true because we're not as active as we once were. Many of us have desk jobs and we sit for hours on end, and we're not getting in that physical activity that helps increase that number. And I think also so much of our diet is so processed, and we eat a lot of foods that are high in trans fats. It's some of the most common foods that we eat in a general American diet. And so the numbers are showing that.
Yeah, I think that's a great area, maybe just to visit just for a moment. But in the diet world, in all of my research, I believe that the two biggest red flags for the American diet or the Western diet, excuse me, probably are, sugar, certainly, which we know is highly inflammatory, but then the seed oils and so on that are overly processed oils that become so toxic in the body, actually adding an entirely different element to the interior wall of the artery, breaking it down and causing all kinds of, number of effects that are adversarial effects. But anything else in regards to, like, in your estimation of what a diet should look like, in regards to maybe making some significant changes in some of these numbers to bring them in a better light?
Well, I would say, in just a, gosh, and this is really oversimplified, but to your point about to the inflammation that some of the foods that we eat cause, and sort of, can increase some of these cholesterol levels, are foods that are highly processed, higher in the carbohydrates, are going to stimulate that inflammatory response. So I would say overall, a less processed diet that is lower in carbohydrates and sugars is always going to be helpful, certainly for everything, but and again in reducing cholesterol. I would say I think something that we underestimate too is just in general reducing the trans fats that we eat in the processed foods. I mean, I think those are two very easy things that we can do, and I know it's difficult to eat some of those fresh fruits and vegetables and those lean meats and things like that would certainly be heart healthy, because they're expensive and it's difficult to do that. And I know you did a talk on that, gosh, I think last summer, but eating healthy on a budget, because that is one of the barriers to getting to that. But those are some of the easier ways to quickly make those changes, that will help improve your numbers.
No, I think that's really good advice. I guess, maybe kind of like as we wind it down, if we have any questions from anybody that's on the call, we'll certainly entertain those. But as far as, like, what would it look like if somebody were to come into the office, come into the CWC? Do you take all the biometrics there, and then you get the information and you have a conversation with the client, or do they come back to get the results? What does this process look like?
Good question. So yeah, if if a person wanted to come and have those things done, they could be in and out in 15 to 20 minutes with all of those numbers in their hand and some information to go with it.
That's fantastic. And I think that that's one of the things that we certainly would like as a spinoff of this little podcast. We would love to encourage people to begin to really start to know their numbers and to see how those numbers change, or for the good or for the bad, over time, and then take proactive action to make sure that they get back on track.
Yeah, and I know you and I kind of talked about this too offline, and I think, obviously tonight, we only have so much time, so this might be a good conversation for another podcast. But a number that we don't really think of in the biometric range, or necessarily even in the know your numbers, but is the amount and the effect that sleep has on, well, really everything. But sleep even affects some of these numbers that we've been talking about. And what is adequate sleep? And like I said, that's probably a topic that needs its own podcast in and of itself, but that's a huge contributor as well.
I think it's a great topic that maybe we could spend just a couple minutes on. It's sort of interesting how it works within the body and in regards to with sleep. What is it that actually changes when we get additional sleep, or we get the correct amount of sleep that we demand? And again, we can talk all day. Like you say, it could be another topic in regards to how to go about it. But real quickly, what changes biometrically when we see people getting more sleep? What happens to the body? Can you give us a little bit of insight?
Probably in just the most oversimplified terms, it allows your body to recover and recuperate and heal. When we continue to shortchange ourselves on sleep, our body does the best it can to keep up. But unfortunately, when we're not getting that adequate sleep, our body can't recover. Our cells, our body can't repair itself, and so each day we start a little bit further in the hole. As kind of a way to understand it is thinking about it like that. So, and I know you and I talked about this a little bit too, but there's sort of this belief that, I don't know if it makes you like a hero or something, that to get less sleep, or to continue to short yourself on sleep. But in the long run, your body needs that time to recoup and recover and be able to be your best the next day.
It wasn't, well, it was a long time ago that I remember in one of my science classes, and we were talking about the autonomic nervous system and the sympathetic side and versus the parasympathetic side. And, lo and behold, now in my world, working with individuals on definitely trying to make lifestyle changes, I think the magic truly is that balance between the sympathetic and the parasympathetic. Like when you go hard, but when you rest, you rest. And that magic balance makes such a difference when it comes to not only general health, but weight loss, and specifically, if it's really hard for an inflamed body that spends an abundant amount of time in a very acute, stressed out state of being in the sympathetic, to lose weight. It's been demonstrated in studies that the more inflamed the body is, the harder it is to lose weight. And so to me, that's another reason why sleep is so important. If you can bring those two in alignment, it sets your body up for success in so many other different ways.
Agreed. Yeah, absolutely agreed.
Anything else, Sherri, before we open it up, in case somebody does want to ask us any questions? And I know we've got a few people here. I see most of the microphones are muted, but if anybody has any questions, please feel free to unmute and ask those questions. If not, we'll be signing off here in just a few minutes. Hearing no questions, and I don't see anything in the chat at this time, I would be, I feel like I would be missing the boat if I didn't take this time to thank you, Sherri, for spending, 35, 40 minutes with us tonight and talking about this and something that I feel is so incredibly important. So I hope that people listen to this on the recording, and maybe that'll invite some questions even on our Facebook page that we can battle around. Anything going on over these next few weeks or months that you'd like to share in regards to the CWC? I know that we're talking about some really big plans. We're going to try to do possibly even a health fair this summer, or spring, if we can pull it off. And really encouraged about doing some things like that. We're constantly trying to get into the buildings to do some things. We're growing our number of wellness champions, which I'm really excited to see. I think we've got 3 just in the Grain Valley area in the district just this past week. We picked up another couple in Blue Springs. And so that's sort of our conduit and our connection to the buildings. And if anybody's listening and you'd like to be a wellness champion, please feel free to reach out to me through email, which you can find that information either on our website or on our Facebook page. And certainly if you need to come in for any clinical care, we've got a great staff for sure.
Yeah, absolutely. Agreed. Nothing really special going on other than something, maybe I would challenge each person that listens to this, but in February is Heart Health Month. And so, what a better time. Well, it's like fresh in our minds. We're talking about it today. You're going to hear about it every day for the month of February, I'm sure. And things that we can do to improve our heart health. And the first thing is to know your numbers. How can we get better if we don't know where we're starting from? And so I would say, call me anytime, any day, and I'll get you set up to come over and get that information to you.
And like you said, what is it, about 15 minutes and then you're out, right?
Yep. And so it's free.
It's free. That's pretty painless, I would say, to find out some very, very valuable information. So Sherri, again, thanks for joining us. And I thank the listeners that were with us today. And we look forward to another edition of the Wellness Zone coming up next month.
Sounds good. Thank you.
Take care. Bye-bye.
Bye.